Good evening, everyone. Myself, Dr. Alicia Sharon from the Department of Microbiology, St. Agnes College, Autonomous, Mangalore. I know that words like corona, COVID, vaccine, pandemic, infection, and lockdown have instilled a lot of pain, dreadful visuals, and fear in our minds. But are these words really so dangerous? Well, today we have assembled here on this e-platform to clarify the doubts and learn the facts related to COVID. Through this webinar entitled All About COVID, Facts and Fiction, we could help one another fight this war against the invisible enemy of mankind. Prayer gives hope. Prayer relieves us from pain and heals us in every way. Our college motto itself says that God is our strength. So before we begin the formal program, we would seek Almighty's blessings so that our session becomes a success and helps each one of us benefit in one way or the other. I now request Ms. Flanny Nikita Martis, our final year microbiology student, to lead us into prayer. Thank you, Nikita, for the meaningful prayer. Our college principal, Sister Dr. M. Vanessa AC, is our source of inspiration and strength. She's always there to support in each and every endeavor of ours. I now request our principal, Sister Dr. M. Vanessa, to address all the participants of this session. Over to you, Sister.
Good evening, Dr. Shrikala Baliga, the resource speaker of today's webinar, teachers, students, and participants. The corona pandemic has been raging from the past 12 to 14 months, and the current surge has been a large one. From the first wave, we have come to the second, and there are fears all around with the news of the third one. To add to it, we have the new fungal infection. The thing seems so hopeless. Times are hard and challenging. We know so much about the virus now, the effect of it, and maybe some of us also the victims of it. We have heard so many people, specialists speaking to us. We have read so much about the virus and sometimes even conflicting things. And we are worried, we are confused, and have many doubts. At times we feel we need some direction, guidance, and help to save ourselves and all from this devastating coronavirus. To get a clear understanding of the COVID infection, symptoms of the disease, precautionary measures, and so on, we have with us Dr. Shrikala. Hope this session will help all of us to gain better understanding and to do away with all our fears and doubts and take care of ourselves and others. I wish all the participants a fruitful session and fruitful time. Thank you and God bless us all.
Thank you, sister, for those thoughtful words. Now, on behalf of our college and the organizing committee, I would like to formally welcome each one of you. I welcome today's resource person, Dr. Shrikala Baliga, Professor, Department of Microbiology, Kasturba Medical College, Mangalore. I welcome you, ma'am. A warm welcome to Sister Dr. M. Vanessa AC, our principal, and to Sister Rupa, our vice principal. I cordially welcome our registrar, deans, faculty of microbiology, and the Youth Red Cross Unit, HODs, and faculty of various departments of St. Agnes College. I also welcome our students, their parents, and my dear friends. And now, I would like to introduce our resource person for this webinar. Anatole France once said, "To accomplish great things, we must not only act, but also dream. Not only dream, but also believe." On this significant day, we have amidst us a dynamic personality who is none other than Dr. Shrikala Baliga. It is because of her hard work. She is a successful microbiologist and a frontline COVID warrior today. It is really an honor for me to introduce our guest speaker, Dr. Shrikala Baliga, as she was my guide and mentor too when I was a student at KMC. She's currently working as Professor, Department of Microbiology, Kasturba Medical College, Mangalore. She pursued the degree of MBBS from Grants Medical College, Bombay University, and the degree of Doctor of Medicine in Microbiology from KMC, Mangalore. She has been endowed with additional responsibilities such as Deputy Director, Quality and Compliance, Mangalore Campus, Mahe, Director, KMC Laboratory Services, Mangalore, Lead Assessor and Technical Assessor for NABL, that is the National Accreditation Board for Testing and Calibration Laboratories. She's also serving as postgraduate professor and guide for MD Microbiology and the PhD students. Madam has immense knowledge and has been in this field of education and research for over 30 years. She has also served as chairperson of the Hospital-Acquired Infection Control Committee for a long time period of 14 years. She was also the head of the Department of Microbiology at KMC from October 2010 to September 2015. She has served as nodal officer for NAC and has also succeeded in achieving A grade in NAC accreditation for KMC Mangalore. She was also the member of core committee for strengthening laboratories for HIV testing, that is for the National AIDS Control Organization from 2008 to 2012. She was also a member of Task Force for National Viral Hepatitis Control Program under Ministry of Health and Family Welfare from 2017 to 2018. She was also a part of Technical Working Group, National Task Force for Laboratory Policy and Strategy Action Plan for Comprehensive Laboratory Strengthening under Ministry of Health and Family Welfare 2017. She has also contributed as an author to National Guidelines on Quality Assurance in HIV Testing, NACO, and also to National Laboratory Guidelines for Viral Hepatitis Testing. She was Grant Proposal Reviewer for the DBT Research Council. She is an Associate Editor for the Journal of Tuberculosis and Mycobacterial Diseases. She holds a total of 75 research papers to her credit in the indexed journals. Dr. Shrikala Baliga has around 6 award papers presented at various national and international conferences. She's been handling various research projects in collaboration with RIA SLR CSM and RIA TB-DX and ID Fish Technology USA for the diagnostics of tuberculosis. She's also handled the ASPIRE study, that is the surveillance study on antibiotic susceptibility pattern of bacterial isolates. She also had a collaborative study with the McGill University and also has an ongoing DBT project. And the list goes on and on. Her areas of interest are HIV, COVID, tuberculosis, quality assurance, and antibiotic resistance. So, madam, we are indeed privileged to have you as a speaker today. So, with this introduction, I now hand over the session to Dr. Shrikala Baliga. Over to you, madam.
Thank you so much, Dr. Disha. It's indeed a pleasure to be here with you once again. And thank you for requesting me to give you this talk on COVID. I agree with your principal when she said that there's a lot of misinformation that is being spread about COVID, due to which there's a lot of fear in the minds of people. And the best way to disseminate the right knowledge is to approach the right people, so that, and to clear your doubts, whatever you have, with people who are in the treatment or diagnosis of COVID and who keep themselves updated with COVID knowledge rather than getting all information from the internet. So with this introduction, I would like to share my presentation. Give me a minute. Can you see the presentation?
Yes, ma'am.
I'll just
Yes,
put it. I'll put it
yes,
on slide. Put it on
yes,
slide. Yeah. Okay, so my talk has been titled as All About COVID, Facts and Fiction. So if you look at the COVID pandemic, and I have put these representative countries from each of the continents: United Kingdom, India, Brazil, USA, and South Africa. What I want to mention here is COVID has no boundaries, and therefore it is a pandemic. It has spread all across the continents. Different countries have different rates of infection. And if you look at the statistics here, we are somewhere at the bottom of the list. India has, if you look at the total cases, 1 in 54 people have been infected with COVID. And in India, the deaths were 1 in 4,097. Contrast that with the developed countries like United Kingdom, where 1 in 15% was people were infected and 1 in 523 died. And in US, total of 1 in 10 people were infected and 1 in 566 people died. So what I mean to say is COVID has not spared any country, be it a rich country or a poor country, be it a developed country or a developing nation. If you look at the COVID timeline, it was in March. It was in March 2020 when WHO declared COVID-19 as a pandemic, where there were almost a lakh cases and around 4,000 deaths in 114 countries. It marched on and on and on with the first wave, which was somewhere for us in India. It was somewhere in August, September, and October when the cases peaked for us. And then there was a small lull in the cases for us in India. And again, from March or April this year onwards, we have got the second wave of COVID. So in on March 11, 2021, exactly a year after WHO declared COVID-19 as a pandemic, we had progressed to 118 million confirmed cases and 2.6 million deaths. But the good part of it was also that 66.7 million people had recovered. We do not actually look at recovery. Most of the time, the only thing that statistics that come is how many people got COVID and how many people died. But please note that 66.7 million people recovered and about 70.5 million were fully vaccinated. If I look at the statistics today, these are the today's statistics. We have 16.4 crore cases
Ma'am,
worldwide.
excuse me, ma'am.
Yes.
Ma'am, the slides are not moving.
Oh, really? Okay.
Oh, yes, ma'am.
I will just try once more.
Yes, ma'am. Yes, ma'am.
I think I have to share the.
It was shared, ma'am. It
Yeah, no,
had
I
to
have to
be the
share the
presentation.
screen. No, I know. I have to share the screen. Now, can you see?
Yes, ma'am.
You can see the slide?
Yes, we can see it, ma'am. Yes,
Oh,
ma'am.
so now, is it moving now?
Yes, ma'am. It is.
Okay. So
Thank you.
I was actually speaking on, could you see this slide?
And now we are able to see it, ma'am. Not
Okay.
earlier.
So I was speaking on this slide just to emphasize that COVID has not spared any country, whether it is the rich country or a poor country, whether it's a developed country or a developing country. If you look at statistics, today in India, we had 1 in 54 people who were infected with COVID, and the deaths were 1 in 4,097 people. If you looked at developed countries like United Kingdom, the total cases were of people who were infected was 1 in 15 and deaths were 1 in just 523 people. In the United States of America, 1 in 10 people were infected with COVID and death was 1 in 566 people. What I want to emphasize is that COVID has no boundaries. So when we call a disease a pandemic, it means it has crossed boundaries across continents and has infected almost every country across the continent. If you look at this world map, you'll realize no country has been spared of COVID. So I was just talking about the timeline. It was in on March 11th, 2020, when WHO declared COVID-19 as a pandemic, and we had about 1 lakh cases. Contrast that to exactly a year later, that is on March 11th, 2021, when we had 118 million confirmed cases and 2.6 million deaths. In India, we had our first wave somewhere in August, September to October, mid October. It peaked in Karnataka somewhere in September to October 2020. Then we had a lull, and then again now the cases have started spiking up, and we have the second wave. So if you see, these are today's statistics. At present, we have 16.4 crore cases worldwide, and about 33 lakh people have died because of COVID. In India, we have 2.55 crores who have been infected with COVID, and we have had 2.83 lakh deaths. So all of you know about this. I'm not going to lay more stress on this particular slide. Everybody knows that COVID-19 is coronavirus disease 19, and it is caused by a novel or a new coronavirus. So this virus has been labeled as SARS coronavirus 2, and coronavirus is nothing but it is a virus which has been known to us from ages. If I look at it from an angle, it is the same virus which caused the common cold. Such a insignificant infection as common cold, which we used to get not only every year, maybe 2 or 3 times a year also. And but it belongs to the same family. But this particular virus, which belongs to this family of coronavirus, is like a black sheep of that particular virus family. Just like we have black sheep in some families, like that only, this particular virus family, that is the coronavirus family, has a few black sheep, one of them being the SARS coronavirus 2. Before this, we had a predecessor of this similar virus called just as SARS coronavirus. And we also had another virus which actually caused infection in the Middle Eastern countries like Saudi Arabia and United Arab Emirates, which was called as the MERS virus. So for all of us, this SARS coronavirus 2 and the COVID-19 disease is a new disease. We are all on the learning curve of this disease. If you ask me, we have still not reached this particular point. So we have still not reached this particular point. We are still somewhere on the way up. Therefore, every day the information changes. Every few months we have new data. Every few months we need to share our knowledge. Every few months we need to update, or rather every day we need to update our knowledge. You will be surprised to know that just before my presentation today, I just changed the slide because just now, about 5 minutes back, I got a Government of India notification, and I had to change some of the data that I was presenting to you. So that's how we are still in the learning curve. So in case some guideline changes, in case some data changes, in case some details change, have trust. Scientists are still working on the virus. They're still trying to put out the best information, the right information, as they are learning more and more things about this virus. So the first question that comes to our mind is, how does it spread? So the most important way by which it spreads is by droplet infection, and also a small amount by aerosols. But the majority of the spread is by droplet infection. Now, what is this difference between a droplet infection or a droplet transmission and an airborne transmission? So a droplet transmission happens, so when we cough or sneeze or when we talk loudly, there are millions of droplets of saliva and mucus that comes out of our mouth. Of course, this is invisible to us, but the larger droplets linger around for a short time. They cannot move far or they cannot move faster. If you just imagine, a fat person can't run fast, cannot go far away, whereas a slim person can run faster and can reach the goalpost faster. So similarly, or can reach longer distance faster. So similarly, the mode of transmission for SARS-CoV-2 or COVID-19 is by droplet infection. The droplets do not travel far. In fact, they linger in the air for a short time and then they drop down on surfaces. Okay, so this is so therefore we say social distancing, because we say these droplets can't go beyond 2 meters. So if we keep a distance of about 2 meters, we are at least reducing our risk of spread. Now, there were articles which said that yes, COVID can also be passed through aerosols, through airborne transmission. This is possible when we have a closed room, a closed environment, or an air-conditioned room, because these droplets can be carried more further away due to the current in a closed room, especially in a AC room. It can be transmitted to more than 2 meters away. So therefore, therefore it is said that it spreads by aerosols in a closed room. Next, coming to surfaces. If you remember, there was a time during the first wave, there were so many messages saying that it spreads on the surface. We saw people doing deep cleaning, cleaning buses, cleaning vehicles, cleaning the roads with disinfectants. As of our knowledge today, what has been surmised is that surfaces are not a major source of spread. Yes, we have to take care. So whenever we touch frequently touched places like doorknobs or commonly touched items, we have to wash our hands, we have to sanitize our hands. But deep cleaning, those of cleaning of surfaces with disinfectants, cleaning of buses, cars, all those things are not needed as per our present knowledge. So the most important spread is by droplet infection, followed by aerosols. How many people can one person spread the infection to? Now, this is also very important to know. Uh, how contagious is COVID-19? So if you compare it with common flu, which we are more familiar with, one person with flu could spread the infection to about just one more person, or say one and maybe maximum two people. But with COVID-19, one person who is infected with COVID can spread the infection to at least 2 or 3 people. And if it is a closed room, he can spread it to many more people, especially in a closed room or in a non-ventilated or an air-conditioned room. Is this a very scary thing? If I tell you something more scary, look at measles. All of us know about measles. One person with it's one of the most contagious disease. But why are we not so bothered about it? Because nobody spreads this information on WhatsApp. Okay, so measles can spread to about 15 to one person with measles can spread the infection to at least 15 to 18 people. So that's how contagious it is. So COVID-19, if I compare it with measles, I feel happy. Okay, fine. It's not as contagious as this disease like measles. Okay. So what happens when we get infected with COVID? So for this, there are three terms which we need to know. One is a pathogen, the immune system, and the response. So what is a pathogen? Pathogen is nothing but these are germs. The germ can be a virus like the SARS-CoV-2. It can be a bacteria, it can be a parasite, or it can be any microorganism that can cause disease in humans. So whenever we get infected with these germs, we have an inbuilt fighting system in us. So it recognizes these things as foreign. So what is this thing which we have inside us? That is called as our immune system. This system recognizes these germs as foreign and then starts to respond. It wants to fight it. So this kind of fight or the response of the immune system towards a germ is called as the immune response. So our immune system consists of certain cells. These are really very, very small cells, and these are called as the T cells. We have the T cells, we have the B cells, and we have the natural killer cells. So both these T cells and B cells and these natural killer cells can recognize the SARS-CoV-2 as a pathogen or as a germ, which is not needed by our body. So whenever a person is infected with SARS-CoV-2, what do these cells do? This cell starts producing chemicals and tries to drive away this particular SARS-CoV-2 from our body. what does the B cell do? The B cells produces the antibodies. So we have heard about these terms called antibodies, and those antibodies also can now kill this particular agent or kill the SARS coronavirus too. So what are the two mechanisms that we have? We have chemicals which are released by the T cells or these tiny cells which can destroy the SARS-CoV-2, or we have antibodies which can destroy the SARS-CoV-2. So when a person gets infection with SARS-CoV-2, remember, infection is not equal to disease. So if a person is exposed to SARS-CoV-2, there is a small percentage which does not get any infection. You are just exposed, but you have not got the infection. Then there are people who get the infection. Remember, in this percentage of people who get the infection, 40% are asymptomatic. They do not show any signs and symptoms of COVID. From them, about 80 to 85% show just mild symptoms. Why do they show mild symptoms? Because their T cells and their antibodies have been able to destroy the SARS-CoV-2 and they go on to the path of recovery. Remember, 80 to 85%, that's the majority of the people. In about 15 to 20% of the people, they can progress to moderate or severe disease. Okay, even in this 15 to 20%, it is just about 5% who need hospitalization. And even in these 5%, the number of people who die is 1.1%. Who are these people who are predisposed to the severe infections? People who are old, who are more than about 60 to 65 years of age, and people who have comorbidities. Comorbidities means some additional conditions like cardiovascular conditions like hypertension or diabetes or cancers, or they are having a problem with obesity, or they have pre-existing lung diseases like chronic lung diseases, or if they are on immunosuppressive treatment like they have a kidney failure, or they're on treatment for cancers. So only in this kind of people, they can undergo severe infection, and also in a small percentage of even younger population without any comorbidities, they can still go into complications. The exact reason why some people go into this kind of cytokine storm, which I'll be explaining later, is not exactly known. So in this small percentage of people, about 1.1%, they go into this cytokine storm, and they are the ones who can have multi-organ failure, and they are the ones who have for whom the outcome is fatal, unfortunately. So these are the facts about COVID that we have to remember. 98.9% of the people who get COVID actually recover from it. About 80 to 85% of the people have mild symptoms which reduce by day 5. About 10 to 15% of the people have moderate to severe disease. I'm reiterating these things again. And very few people, about 5%, only need the hospitalization, and case fatality is about 1.1%. The incubation period, that is the time from which you were exposed to the virus and to the time by which you show the symptoms, varies from about 5 to 7 days. And what are the symptoms of coronavirus? Just like any symptom of a mild viral infection. So patient may just present with mild fever, with fatigue, or fever with chills, or cough, or sometimes they can even present with vomiting or diarrhea, or even loss of taste or smell. So all these are because the coronavirus infects cells of the upper respiratory tract, and therefore most of these signs and symptoms, what you see like loss of smell, loss of taste, sore throat is all because of that. When it gains access into the lower respiratory tract, you can still, at that time, you will have this shortness of breath. So what should you do if you are positive? So if you are positive, mentally, you have to stay positive. Always remember the fact that majority recover from the disease. Contact your doctor. Extremely important. Please do not self-medicate. Stay at home, take rest, stay hydrated, take whatever has been prescribed by your doctor. At this stage in early disease, we do not need any big medicines. We just need a paracetamol to keep your fever in control. This is the time your body is actually fighting to remove the virus. Therefore, you're having fever. Therefore, you're having that mild cough. Therefore, you're having the body ache because your immune system is producing those chemicals, it's producing those antibodies, which is now going to remove that virus from your system. Okay. So that is why you're having all these symptoms. So if others at home are not having symptoms, please quarantine yourselves in a room. If possible, use a separate toilet. Otherwise, please clean the toilet after your use. Wash your plates by yourself. Soak your clothes in soap and water. If someone needs to come to your room, please see that you're wearing a triple layered mask. This is a common surgical mask that is used, or a double layered cloth mask. This is because you are infected. All your close contacts in the house should be tested on the 5th to 7th day of exposure. Your close contacts, by that I mean a primary contact, or earlier, or if they show symptoms earlier, they have to be tested to know whether they're having COVID or not. This quarantine period in our state is about 10 days of quarantine, or if your 10 days are over and you're still symptomatic, after all, you have to quarantine about 4 or 5 days after your last symptom if you're symptomatic for a longer duration. What if your symptoms persist? As I mentioned earlier, in a small category of patients, that is about 10 to 15% of the people who are symptomatic, symptoms can persist beyond 5 to 7 days. So what are the red flags that you have to see? You have to, if the red flags are, if your fever persists beyond 5 to 7 days, if you start having a deep hacking cough, if you're having a difficulty in breathing, these are all red flags to tell you that your disease may prolong a little longer. There are two things you can do. You can check your saturation. This is by a pulse oximeter. Your saturation should be more than 95, and you can check your temperature. Even if you're having mild fever, it's fine. But if your fever persists, cough persists, you have difficulty in breathing, please consult your doctor. Please remember, even at this stage, everybody does not need hospitalization. Please do not insist on hospitalization. Please do not insist on certain medicines that you need to take because your doctor or your physician knows much better. He reads the protocols every day. He knows what medication to give you. Do not insist on hospitalization because the hospital is reserved only for those last 1% of the cases who actually need external oxygen support, and therefore please do not occupy beds when it is not needed for you to be there. Getting admitted in the hospital itself is a risk of acquiring other infections. So why do these people go into this category? So if you see the efficiency, what is the function of our lungs? The function of our lungs have these small air pockets. Okay, so these are called as the alveoli. So in this alveoli, these are nothing but airbags, and this is the place in which the fresh oxygenated air comes in, and your blood vessels take the oxygen from these air pockets and then give that oxygen to all the other organs of your body. So what happens in a person who is infected with COVID? So in a person who is infected with COVID, if you see, these air pockets now have the SARS-CoV virus. And what does the immune system do? So even in these particular um, air sacs or the air bags, we have these tiny cells that I just showed you earlier. So these also start functioning now. So they say, okay, we don't want this virus here because it's going to interfere with our air exchange business. So what they're doing, so they start producing the antibodies and they start producing those chemicals. So when they start producing these antibodies and chemicals, unfortunately, what happens in some people is these antibodies fail to kill the virus. They do not kill the virus, so the virus keeps multiplying. And these antibodies also do a very unfortunate thing. They start recognizing some portions of our blood vessels itself as foreign, and they go and attach to them. So what happens when these antibodies go and attach to these tiny portions of the blood vessels? We start getting clots. So what happens when these clots form in the blood vessels? Your air exchange suffers. So what happens when your air exchange suffers? Your tissues start getting lesser oxygen. So when your tissues start getting lesser oxygen, that is the time one feels breathless, and that is the time you start going into a phase in which your organs cannot function. Okay. So what is this term called as happy hypoxia, which is mentioned very often? Please remember, just like many of the organs in our body, even the lungs have a capacity to withhold for a long time. So unless so a person will not feel tired, he will not feel breathless till a large portion of the lung has been destroyed. Therefore, this is called a happy hypoxia. So you may still show, you may not be breathless, but actually the perfusion that is taking place, the oxygen exchange that is taking place in your lungs is at a very low level. So that is why we say you have to check the oxygen saturation with the help of a pulse oximeter. Anywhere less than 94, you have to call your physician and he will give you instructions on what exactly needs to be done. So please remember, getting COVID is not like getting a death sentence. So what is the testing for COVID? You take a nasopharyngeal or oropharyngeal swab, and the only test available now is the RT-PCR test. Okay. So this test, we do it in different ways. We do it by the conventional RT-PCR test. Then there are some automated machines like gene. So the conventional test will take about 2 to 3 hours. A gene expert will do it at a faster rate. Maybe you'll get the test is done in about 1.5 hours. And we have even newer methods which use the same principle but give the report faster, which is called as the ID Now, which can give the report in almost 10 minutes. So as the days go by, we have different ways of testing COVID, but the basic test or the gold standard even now is the RT-PCR test. So in this test, a small amount of the RNA of the virus is enough. We multiply it in our labs by 2 million-fold, and that is then detected by this particular test. So how do we prevent COVID? So the 4 main strategies, the vaccine has been added now, is the main strategy is by using a mask. Always use a mask, especially when you're going out. For people, a simple cloth mask will do. If at all you're coming to hospitals, you can wear a triple layer mask or you can wear a double cloth mask. And if you are, and this N95 mask is only for the doctors, since we do a lot of other duties which can generate aerosols. So we are at higher risk. So this N95 mask is not needed for the lay people. Social distancing, I already mentioned the reason for this 2 meter or 2 gaj ki duri as it is called for social distancing, and use a hand sanitizer or wash your hands frequently. And now we have a new weapon with us, that is the vaccine. Okay. So what are the vaccines available in India? So we have 2 vaccines. that is the Covaxin or the Covishield vaccine. Okay, the Covaxin is an inactivated vaccine, which is a wholly made in India product produced by Bharat Biotech, and this we need 2 doses 4 weeks apart. The Covishield is a vector vaccine. This is manufactured by Serum Institute of India. This also needs 2 doses, and recently the timing of the dose has been changed to 12 weeks apart. Okay, so please do not worry about these timings, because when we took the vaccine as healthcare workers, we took it at a gap of 4 weeks. After that, the advisory came to take it at 6 weeks. So when we gave our parents, it was at around 6 weeks. Now the government of India has said 12 weeks. We should not be skeptical or worry about this. In the United Kingdom, this same vaccine, that is the AstraZeneca vector vaccine, was given as 2 doses 12 weeks apart, and it has also shown good efficacy at that particular uh, difference of 12 weeks. Vaccines in the pipeline, Sputnik has already come. It has been launched in Hyderabad yesterday, and these are the imported doses, but we still have to manufacture this vaccine in our country. And there are 2 other vaccines, which is again by Indian companies. The one is by eBiologicals, that is a subunit vaccine, and a nasal vaccine called Codagenix. Then there is another vaccine called as the DNA vaccine by the Zydus Cadila company. But all these vaccines will take some or the other time to come, and they still have to publish their phase 3 trial or the large scale trial results only when they will be licensed for use in our country. So how effective are these vaccines? Please remember, whatever vaccines are licensed for use in our country or anywhere, both are equally effective. Both vaccines protect from complications of the disease and reduces the mortality from COVID. It prevents a person from going into that severe disease and also reduces the need for hospitalization. In a recent study about just 2 or 3 days back, which I read, it said that it reduced hospitalization of vaccinated people to only 0.06%. Remember, without the vaccine, the rate of hospitalization is at least about 5% of the people going for hospitalization. But if you take the vaccine, your chance of getting hospitalized is reduced to 0.06%. Yes, you can still get vaccine, you can still get infection in spite of being vaccinated, but most of these infections will either be asymptomatic or mild infections, and recovery is also much faster in vaccinated people. There was a very interesting study which I came across from Mumbai and in Pune. They have seen that the number of the mortality in the older age group, who were the first group to be vaccinated in our country, has apparently come down. It's lesser than that what they have seen in the first wave. And one of the hypotheses they're putting forward, and which has to be proven, is that probably it's because many of them were actually vaccinated. This is a very interesting study for which I put up this slide so that all of us understand the vaccination status and its relation to disease. So this was a study done in Israel. Israel, as you know, has vaccinated almost 80% of its population. So they checked the infection rates in people who were given 1 dose of the vaccine but less than 14 days. Remember, the protection comes after about 14 days after the first dose, and again after about 14 to 28 days of the second dose. So when they saw the rate of infection in people who were vaccinated with 1 dose but less than 14 days, the amount of people infected were around this much. After the first dose but more than 14 days after the vaccination, the infections reduced to this much. After 2 doses, less than 14 days, infection was just this much. 2 doses more than 14 days after the second dose, infection is just a small amount. And look at this large group of people, the infection in the unvaccinated population, it's just spiking. Okay, so this particular graphic I put just to stress on the importance of vaccination for everybody. Are vaccines safe? Yes, vaccines are extremely safe. Whatever reports you would have read of clots or whatever the complications of vaccine is extremely rare. Please remember, it is just about 5 in a million cases. And in India, yesterday they have reported that in India, the rate of clots is just 0.6 per million. And if you don't take the vaccine, and if you get COVID, as I explained, getting COVID itself gives rise to clots. The chance of getting clots is increased to 39 per million. And the chance of us dying with a road accident is much higher than whatever numbers that you're seeing here now. So vaccines are extremely safe. Please take it. Which vaccine is better? I put this up here because this is the story about a donkey which was confused whether to eat the hay first or to drink the water first. So in the process of this confusion, it unfortunately starved to death. So both vaccines are equally safe. Please take whichever vaccine comes your way. If you're giving Covaxin, please take it. If you're given Covishield, please take it. So there is nothing better than the other. Both are equally safe, both are equally efficacious. Who can take the vaccine? Anyone above the age of 18 is eligible to take the vaccine. Even people with comorbidities. Please remember, just because you have diabetes, cancer, hypertension, chronic lung disease, please take the vaccine. You all need the vaccine much more than a healthy person. Even if you have got COVID, you have to take the vaccine. It is not 4 to 8 weeks. Just today, Government of India has changed this also to 12 weeks or 3 months after the symptoms disappear. There are just temporary contraindications. So I just changed it here. I forgot, sorry. So who should avoid the vaccine? Pregnant women. In today's directive, Government of India has said even lactating mothers can take the vaccine. I had actually put lactating mothers in the slide. I just removed it just before I came for the presentation. So as of today's guidelines, lactating mothers also can take the vaccine. People who are below the age of 18 years, because vaccine trials have not happened in this particular age group. People who have severe allergic reactions to components in the vaccine or injectable therapies are again requested to avoid the vaccine. Please contact your doctors for this particular contraindications regarding allergic reactions. Temporary contraindications for 3 months after recovery. So even if a person is having active symptoms of COVID-19 infection or is COVID positive, you have to wait for 3 months after recovery. And if you have been given plasma therapy as a part of your COVID-19 treatment, you have to wait for again 3 months after recovery. If you are acutely unwell, not because of COVID, because of some other medication, some other illness, then the gap should be about 4 to 8 weeks after recovery from the infection. How to overcome fear about COVID? The first and foremost thing what you should do is stop receiving, you can't stop receiving, I'm sorry. Stop forwarding messages about COVID on WhatsApp. Please do not become a WhatsApp university graduate regarding COVID. If you have any doubts, anything about COVID, please ask qualified healthcare personnel who keep themselves up to date regarding COVID knowledge. Please do not fall to infodemic. More dangerous than the pandemic is this infodemic, that is the information pandemic, which comes out through the cell phones in the form of social media. Please do not be a prey to that. Yes, I understand. In the second wave, we have had the surge was huge. So many of us would have either become victims of COVID or would have had some of our near and dear ones we may have lost to COVID. If if it is really causing you a lot of mental disturbance, a lot of fear about this, please take medical help. Please consult a qualified psychologist. Please share your fears and your anxiety with them, and that may help you feel better. So, what are the myths about COVID? There are so many myths, and none of them is right. COVID spreads through chicken and meat. So many people stopped eating non-vegetarian and became vegetarians. No, it does not spread through chicken or meat. Anything we boil, cook, and eat, it does not spread through that. There was a time, and I do not know, even now, I think many people, they do this. They wash the vegetables thoroughly before entering the house. I have seen people washing vegetables outside their gate of the house and then only bringing it. No, it has been disproved. These are not a source of COVID infection. You can, as long as you're washing it before you eat, that is more than enough. As long as you're cooking vegetables, it is more than enough. So these are the kind of actions which make people very, very anxious. To tell you very frankly, I have not done this even for a single day. Okay. So please do not get bogged down by these kind of things and just live a normal life. COVID vaccine produces sterility. No, it does not produce sterility. COVID vaccine can't be taken during periods. No, there is no relationship between COVID vaccine and the periods. COVID vaccine alters DNA. It has nothing to do with our DNA. It does not alter our DNA. Eating garlic prevents COVID. No, there has been no scientific study on eating garlic preventing COVID. Everyone dies, everyone who gets COVID dies. No, I already stressed on this fact that the mortality or the case fatality rate is just about 1.1%. COVID is like flu. No, COVID is not like flu. We cannot take it as lightly as we take the flu. It is slightly more dangerous than flu because as of now, we do not have any proper medication for it and it spreads much more rapidly and to many more people than a common flu does. Cats and dogs spread COVID. No, cats and dogs do not spread COVID. And black fungus is not black. Okay. Now this whole issue about black fungus again, uh, which is so much of information is available on the media. It was as if black fungus or mucormycosis, as has been told, has been discovered just because of COVID. Unfortunately, no. Mucormycosis has been there from years, from ages. We have been diagnosing mucormycosis in our labs. We have been diagnosing mucormycosis in people with uncontrolled diabetes. We have been diagnosing mucormycosis in people who are on immunosuppressive treatment. So there's nothing, it is not anything new. Yes, in COVID, what has happened is when people have taken steroids for a long duration, steroids suppress the immune system. Because of this, a person becomes more prone to mucormycosis. Similarly, steroids again will shoot up your sugar level. So your diabetes becomes uncontrolled. So that again predisposes to mucormycosis. So it's because it's like a collateral damage which has been caused because of which we are seeing more cases of mucormycosis. And mucormycosis is not black; it is a nice white fungus which we grow in the lab. I'm sure Dr. Lisha will vouch for it. And black fungus is actually something else, but it's a common name, common terminology used for this fungal infection because it causes black lesions. That is because of the destruction of the tissues wherever it grows. So that is why it is a misnomer which is being spread right now. Okay. Immunity boosters cure COVID. No, immunity boosters may help you feel better. You feel good after taking immunity boosters. But as of now, there are no scientific papers which say that just because you're taking immunity boosters, you can be cured or you can prevent COVID. So these are the myths regarding COVID. Please do not, I've just put a few, there are hundreds of more. So please do not believe these myths. So the data as on 17th of May 2021, if you see, I put up this slide just to put a positivity in your minds. Please see the number who have been discharged. 84.81% have been discharged, recovered from COVID, and are all back home. We have only about 14.09% who are in active cases, and our mortality, this is Indian statistics, is about 1.1%. So please look at the positive side. If you look at this circle, the blue stands out. So please stay positive. Do not get bogged down by the fear. Whether there is vaccine or no vaccine, first wave, second wave, no wave, approaching third wave, whatever it is, please use COVID appropriate behavior. Wear a mask, use social distancing, and please clean your hands using soap and water or sanitization. But unfortunately, in our country, this is the style of wearing masks. This is the style of social distancing that we have. So to end my talk, I just have a few take-home messages. Please do not panic if you have COVID. Almost 80 to 85% recover from that. Only a small percentage require hospitalization. Your doctor is the best judge to let you know whether you need a hospitalization. Case fatality in India is just about 1.1%. Don't be a WhatsApp university graduate. I can bet on it if we had this much of information passing on regarding tuberculosis, which is a much more prominent disease and which has killed a large number of people in our country, we would have thought that we are more susceptible to tuberculosis. But unfortunately, TB doesn't spread on WhatsApp as much as COVID does. Okay. Take information from the right people when in doubt. Follow your responsibilities. This is extremely important. All the time, we know how to blame, we know many things we do, but please remember, we also have certain duties and responsibilities towards ourselves, our family, our community, our society, and towards the world at large. Please follow your responsibilities regarding COVID appropriate behavior. Please wear a mask and wear it properly, not under your chin. Please do not remove your mask when you want to talk to people. I've seen this so often. People wear the mask and when they want to talk to you, they just put it down and they talk, thinking that the other person cannot hear. No, when you talk, you're dispersing your saliva, you're dispersing those droplets in the air. The other person is at risk. Please do not remove your mask. Please maintain a distance. Even if you're going shopping, many of the shops insist, but I've seen many of them do not insist on the social distancing. Even if they do not insist, you maintain the distance. Each one of us can do our bit to prevent the surge of COVID. And please remember, we are still learning. We're still on the learning curve. Every day is a new day. Every day we get new information. So we have to keep up to date. Please stay informed with the right information. So with this, I conclude my talk. Thank you very much for your patient hearing. If you have any questions, you can please share it.
Thank you, madam, for that informative talk. You have touched upon all the aspects of the disease, in fact, and I'm sure that madam's talk would have reduced the fear from our minds by now. I guess we have a question or two on the YouTube chat box, ma'am. I would like to present them to you.
Yeah.
Ma'am, the questions are basically regarding the vaccine itself.
Yeah.
So one of the participants has asked, can people who are taking steroid as medicines take the vaccine?
Yes, they can. They can take the vaccine. Their response may not be as much as a person without steroids, but yes, they will also respond. Maybe there will be a little delay in the formation of the antibodies, but yes, it will be there. So even if you're taking steroids or any other immunosuppressive medicine, say for cancer, you're taking any anti-malignancy drugs, even then you can take the vaccine. In fact, these are the people who need the vaccine much more because they have the comorbidities for COVID complications.
Okay. Ma'am, the second question is, what if we have taken the first dose and have missed the second one?
No problem. Now you have to take it after 3 months. First, if it is Covishield, you have to take it after 3 months of the first dose. If it was Covaxin, you would have had to take it at 4 weeks, but no harm. You can always take it. Please register yourself and take your second dose. There is no harm if you miss the second dose. Whenever it is available, please take it.
And the third question is, ma'am, when can we expect vaccine for children?
Okay, that's a very good question. I didn't touch upon that because I expected a question on the third wave. So with so many people being vaccinated, especially in the adult population, the vaccine trials have been conducted for people who are above the age of 18. But the good news is we have in the US, the Pfizer vaccine, the trials have already started in children. And the good news for us in India is Covaxin has already been registered for a trial in children. So we are already preparing for the third wave. So what we are looking at in the third wave is we are expecting, it may not be, we do not know. It's a hypothesis that we are just building that almost everybody above the age of 18 may be protected because they will take the vaccine. So we have this large population of people who are below the age of 18, and we expect that maybe they will be the ones who are predisposed to COVID and they'll get the infection. So the trials have already started, and I'm sure by the time the third wave begins, these trials, we may have some results from these trials, and vaccine may become a reality for the children also in the near future.
Thank you, ma'am. Thank you once again, madam, for those and the valuable inputs from your side. Thank you so much, ma'am. I have a small notice for our participants. Kindly note that the feedback forms are made available through the feedback link, which is given in the YouTube chat box. And please do give us your feedback about the webinar. This would help us evaluate our work and encourage the team to accomplish the future goals.
Thank you very much, Disha. Thank you very much to all the organizing committee. It was a pleasure being with you all.
Thank you. Thank you is the best prayer that anyone could say. On behalf of the Principal St. Agnes College, Autonomous Mangalore, and the Departments of Microbiology and Youth Red Cross, I take this opportunity to thank our resource person, Dr. Shrikala Baliga, Professor, Department of Microbiology, KMC Mangalore, for taking time off her busy schedule and accepting our invitation to be the resource person of today's webinar. She has indeed spoken on most of the important and applicable aspects of the COVID. It is really difficult for a layman to understand this topic unless explained in an elaborated and simple way. But our speaker today has put all the biological facts of the disease in simple terms and made us understand the real key points. I personally feel that now we know more about the disease and also the way to battle this pandemic with the combination of masks, sanitizers, social distancing, and the upcoming vaccine, and most importantly, with the fearless mind. I'm sure that all our questions as listeners are also answered. Thank you once again, madam.
Thank you.
My sincere thanks to our principal, Sister Dr. M. Vanessa, for her encouraging message and unstinted support. My heartfelt gratitude to our Vice Principal, Convener, Co-Convener of today's program, Registrar, Deans, HODs, and faculty of all the departments for their presence online. Special thanks to Mrs. Simanthini Carroll, Assistant Professor, Department of Computer Applications, for assisting in organizing this program. I thank Mr. Gurucharan for the strong technical support. Thank you, students, parents, and dear friends. Finally, knowledge is of no value unless you put it into practice, says Anton Chekhov. So, let us all together, spaced distantly, work hard to bring an end to this pandemic. With these words, I would like to sign off. Thank you, one and all. Stay at home, stay safe, and good night.
Good
Thank
night.
you, ma'am.
Thank you very much, ma'am.
Thank you.